me for this opportunity to present our work. This study comes from Brazil, from our old age research group named Proter. My name is Ricardo. I'm a PhD student, and my mentor is Casio. He's over there, and I'm sure you will check me out here. I hope I'm going to be okay. We're going to try to show you, share with this data, when we'll try to understand how some variables could impact the prevalence of dementia among Brazilian elderly. Mainly here, we try to understand lifestyle, clinical disease, and sociodemographic factors. As a brief background, previous prospective studies have shown that leisure activities could lower cognitive decline and reduce the risk of dementia, and including Alzheimer's disease. In the context of lifestyles and leisure activities, perhaps we assume, we believe, some authors do, that could delay the incidence of Alzheimer's disease. And we have at least 5 suggested theories that try to clarify this possible benefit of leisure activities. And I think the best one is the cognitive reserve theory that show more efficient neuronal networks in those subjects that could delay perhaps the onset of Alzheimer's disease, or they could effectively use alternate networks after brain injury, for example. And not as important, but educational level and occupation, social network, physical conditions, for example, cardiovascular diseases, stroke, and other things. And I think it's very good to believe that physical activity could improve the health as we age. This is from Brazil. Our colleagues from Porto Alegre, south of Brazil, determine or they show some difference between normal agers and successful agers regarding to conditions, health conditions in general, not focus on cognitive impairment, but generally. And as a definition, it's not a consensus. I think this need more extensive investigation. But successful agers is a name that try to explain people having good health condition with absence of functional and cognitive impairment and changed moods. And those people would have more leisure activities, higher educational level, and higher family income as a possible protagonists. Some information about our data. We have this review of prevalence of dementia in Latin America. When you could see here, 7.1% of dementia prevalence is similar to developed countries and similar to our stand from São Paulo, from our old research group up there, that shows 6.8% of prevalence of dementia prevalence, and Alzheimer's disease playing the big 59.8% of prevalence. And the factors associated were 70 years or older, literacy, major depressive disorder, yes, stroke, and reading books as a leisure activity, cognitive stimulation leisure activity, currently working, and cancer. Just a start. Okay. Our aim is for first of all estimate the prevalence of dementia syndrome and try to understand those these associated factors, lifestyle. Take lifestyle in this context, considering leisure activities, physical activities, seeking for health care, religious beliefs, smoking, drinking, and nutrition, socioeconomic behavior, occupation or employment conditions, life stress events or conditions, and clinical disease, sociodemographic factors. So it was in Ribeirão Preto City with a population of 586,000 people, with 10% of other people. Cross-sectional study, and we evaluate 1,145 other subjects, the mean age of 70.9, 36.6% of male. And these tools we use in order to screen the cognitive and functional impairment and to determine the diagnosis, the major diagnosis, based on DSM-4 criteria. The results, when we evaluate these factors individually, we have the univariate analysis show independent factors like age, occupation, educational level, social class, marital status, currently working, stroke, physical activity, and leisure activities. The prevalence of dementia syndrome was 5.9%, similar to the prevalence of São Paulo and Latin America. And Alzheimer's disease, almost 45%, vascular disease, almost 20%, and we add both of them together, 6.4%. It's the type of dementias. We have alcohol, frontotemporal dementia, and traumatic brain injury too. And the results, when we combine them all, a lower prevalence of dementia were found in people having frequency of watching TV many times a week or even every day, reading journals and reading books, with a more significant association. And higher prevalence of dementia syndrome in people aged 8 years old, 80 years or older, and previous history of stroke with a odds ratio of 5-fold, and the age bracket with 7 odds ratio. This is the table with the perfect analysis. I want to highlight here the most important factors, variables associated, and the significance of each one. We move forward to trying to understand, because these so common conditions and variables associated to dementia prevalence not remain after the good faith analysis, and we can believe here that people with dementia had more prevalence of worse conditions regarding to schooling, physical activity, reading books, reading journals, going to cinema, playing games, and watching TV. That means if you compare the physical activity, people with dementia were practicing 2.2%, and not dementia 54.8%. And when we analyze watching TV, 91.7% of the non-demented subjects had the habit to watching TV, and among demented, 5.7% only. As a conclusion, the prevalence of dementia, Alzheimer's disease was the most prevalent, followed by vascular dementia, and a higher prevalence of mixed dementia, similar to the literature. Risk factors, age, stroke, and as a protective, we believe, we assume this, leisure activities, physical activities, not here, neither educational level, and neither too for cardiovascular disease. But we have that some suggestions about this because previous studies have shown that different conditions could modify the impact of cardiovascular disease. When we have perhaps an impact of an amount of the number of conditions, of clinical conditions, having a better impact, greater impact than one specific condition, for example, cardiovascular disease. And we combine physical activity with each of those leisure activities, and the leisure activities had greater impact than physical activity in this study. And the same happened with educational level. Perhaps people engaged in physical activity have more, are more frequently engaged in leisure activities. This is our team in colleagues. I think this is the last one. Obrigado por sua atenção.
Thank you very much, Ricardo. Time's up. So anyone who has questions for our speakers, please come to the front and talk to them. Please join me in thanking all of our speakers for excellent presentations today. Thank you very much.